welcome to the show. The topic this morning is public health concerns revisited, and we're fortunate to have with us Dr. Stephanie Bailey, who is the medical director for the Metro Health Department. And let me welcome you to the show this morning, Dr. Bailey.
Thank you.
Dr. Bailey, we thank you first of all for coming by and giving us some information dealing with some of the public health problems and public health concerns that we have. As a matter of fact, I think it was at your suggestion that we title this Public Health Concerns Revisited. And when you give us some information about your background and your responsibility, I want to get into why you look at these concerns as concerns that we visited once before. But first of all, why don't you give us some information about your background and how you came to be the director for public health for the city of Nashville and Davidson County.
I was born in Denton, Maryland, which is about 70 miles from Baltimore on the eastern shore of Maryland. We call it the land of pleasant living. From there, I went to school in Massachusetts and graduated with a BA degree in psychology. Went to medical school at Meharry Medical College and went on to do my internal medicine rotation at Emory University Grady Memorial in Atlanta. Coming from a very modest background and a big family, so to speak, in Maryland, there wasn't very much money around, so scholarships were very important to our education as children. One of the institutions that helped me out through medical school was the National Health Service Corps. So from my internship at Grady Memorial, I repaid back my National Health Service Corps obligation 2 years in rural county in Tennessee, in Dixon, Tennessee, and Fairview. From there, I came to go into public health with the Metro Health Department, and I've been there since 1981, and I became medical director in January 1988, and have been that since then. Some of my responsibilities also include being over the Bureau of Health Services that have under it about 7 divisions to include 9 primary care clinics, public health clinics, the correctional health services, the homeless program, the indigent drug card, the dental services, all fall within the Bureau of Health Services, for which I am over. So my education and the path to getting there was through higher education and then getting into public health for 10 years, and sort of got me there.
You also mentioned the fact that you received financial assistance through a program that allowed you to give back some time to the community.
That's correct.
Why don't you explain that program? Because there are a large number of young people who would like to become perhaps involved in medicine, but might not have the financial resources. But I think that this is an option to increase the number of physicians in what might be called underserved areas.
That's
and so
correct.
Let's talk about that before we get into
It's called the National Health Service Corps, and it had been around for a while. And when I was in school, that was one of the primary resources for getting through school. The National Health Service Corps has gone through some changes because there was still a need of physicians out in communities, and they weren't putting physicians out in those communities, so it sort of lost some funding for a while. And I think over the last year or two, they have revamped that program. And it's through the federal government, and they pay you for your years in school, and then for that, you owe them back each year that you have received assistance in some area of need. And Tennessee has some of those areas also. And
so Tennessee, Meharry participated in that program, and as a result of that program, that you were able to get your financial resources necessary for your degree.
That's correct.
But you also had to go back into the community.
That's right.
And it's sort of a Peace Corps-like operation that's probably geared to professionals more than anything else.
That's right.
Would it not be?
That's right.
Very good. Now, your responsibilities, I think you mentioned that not only are you the health director, but you're also in charge of another area in Metro government. Now, what area is that again? And
the Metro Health Department has 4 bureaus with 4 bureau directors. There's the Bureau of Finance and Administration, there's the Bureau of Nursing, and the Bureau of Environmental Health, and the Bureau of Health Services. The Bureau of Health Services is the one that I direct.
Which means that you've got a large number of employees under your
Yes.
direction. Why don't you give us some information in reference to that operation?
The Bureau of Health Services has the primary care clinics, the public health clinics. We have 9, one of which is the homeless clinic. Each clinic is primarily run by a family nurse clinician who is the main provider and the nursing staff. In the clinics, we do basic public health things, well child care, immunizations. We do nutritional services, WIC vouchers and supplemental food, prenatal care, family planning, and also acute primary care. From the clinics, and they're located pretty much throughout all the county, and we think they're accessible to most of the county residences who we serve. Also in the Bureau of Health Services, we have correctional health services, which include the workhouse, the Hill building, and the criminal justice building. And we administer services, healthcare services to that group of population. The indigent drug card falls under the Bureau of Health Services, and that's, most people will know that as the Metro card.
What's that now, the indigent
drug program, and it's, like I said, most people know that as the Metro card. That's a system almost like Medicaid, where we have recognized over the past that there are a level of the population that's not eligible for Medicaid but still falls within poverty ranges, can't afford their medication, on 6 or 7 medicines. So we have a program that addresses that need. We allow indigent patients to get up to 7 medications at a drugstore, and we pay for that cost.
Now that's a very, very expensive program, is it not?
It has been increasing about 10 to 15% over the last few years, and we have recognized the need that we have to do something to curtail that. We recognize that we can't fulfill the needs of everyone, so we try to do what we can for most people. Like most people will have your elderly people with diabetes, hypertension. We try to get at our chronic diseases. We try to get at those kind of things that when you take your medicine will give you a better quality of life. So we gear our program towards that population as much as possible.
Now, do you get funding for this from the federal government or from Metro government? Exactly who pays for the supplemental drug program?
This is a Metro government supplemented program. It's a charter that we do this, and we do this.
Oh, very good. Now, within that area, you